As I said, we're marking up 6 bipartisan health bills, including legislation to reauthorize and improve programs at the FDA, address the mental health and substance use disorder crisis, and establish President Biden's ARPA-H initiative. We will begin today by taking up the Food and Drug Amendments of 2022. This is comprehensive bipartisan legislation to reauthorize FDA's user fee program and improve FDA's review of drugs, biologics, and medical devices. The bill will also reduce drug costs, improve program integrity and oversight in the accelerated approval program, and improve diverse representation in clinical studies. With the ongoing infant formula shortage, I'm pleased the amendment in the nature of a substitute will extend an authority first provided in the 21st Century Cures Act that will allow FDA to retain top scientists and high-level professionals, not just for its drug, biologic, and medical device centers, but also the Center for Food Safety and Applied Nutrition and other product areas regulated by the agency. While we certainly have more work to do in this area, including this provision today will improve the agency's oversight of these products, including infant formula, and help avoid tragedies that led to the death of 2 infants due to contaminated formula. Now, this bill has been crafted with consensus in mind from the start, as it is critical we pass this on time before FDA funding runs out. We don't want them sending out the pink slips. Next, after the FDA user fee bill, we'll turn to the consideration of the Restoring Hope for Mental Health and Well-Being Act, which I introduced with Ranking Member Rogers. This is a comprehensive bipartisan package that includes provisions from members of the committee on both sides of the aisle. It reauthorizes more than 30 programs that aim to help Americans in need, providing access to critical mental health and substance use disorder support and care. We'll consider 2 amendments to the mental health package that represents months of bipartisan negotiation on 2 important bills, the MAT Act and the MAID Act. And together, these policies will increase access to medication-assisted treatment for opioid use disorder and substance use disorder treatment, as well as help address some of the stigma associated with addiction. And I'm glad that we were able to work together between our subcommittee markup and today's markup on these 2 amendments, and I'm hopeful they'll be included in our mental health package as it advances out of committee. We'll also consider another amendment that will help strengthen mental health parity by providing funding to states to implement and enforce parity. This is critical in eliminating disparities in insurance coverage and treatment. And I must say that this committee has worked for years to try to address this parity issue, and we constantly have to, look back and see what else needs to be done. So this is what we feel needs to be done. The committee will also vote on 3 bipartisan bills and the Bipartisan Advanced Research Project Agency Health Act, or ARPA-H, led by Chairwoman Eshoo. And this bill will create an independent ARPA-H that accelerates biomedical innovation and makes transformative breakthroughs in the most challenging diseases. So I look forward to advancing all 6 of the bipartisan bills, and I really thank wholeheartedly our Ranking Member Rogers for her shared commitment to making this bipartisan markup possible. Thank you, and I will yield to the Ranking Member.